Okay. Is this, okay, I'm on. You're on. Thank you. 10 minutes, right?
Yeah.
Okay, he's on me. Just wanted to walk you through this quick case study that we did on Addressable TV. And before I even dive into that, I want to make sure that we have a little pity party for me. I want to kind of talk through the headwinds that I was kind of facing to even walk into the client meeting and present that I thought this might be a good idea for us to go ahead and test. We'd done a traditional television heavy-up test of 2 to 3 years ago, didn't work. So the client is already in the mindset that, oh my gosh, why am I doing local TV? It doesn't work. The other sort of thing that I had to contend with is I'm measured almost exclusively on ROI. If I don't hit an ROI for what we're planning and what we're spending in media, I'm going to have some splaining to do. So wanted to make sure that as we went in here, and I'm looking at premiums versus what we pay national TV, I'm looking at a client that doesn't even think this is a great idea to begin with, that we set this up carefully to succeed. So just to kind of walk you through, this took a village for us to get it done. I wanted to walk you through some of the partners that we work with. I work for Klick Health. We are a full-service healthcare agency based out of Toronto. We actually mostly handle US pharmaceutical business. Crossix was our data partner. They enable us to tie back actual prescription data to audience exposure. So think about it a little bit like you would think about if you were a packaged good, the way that you would think about retail scanner data. Charter, we worked with as our media vendor partner. The reason I picked them was a couple of things. They had one of the biggest footprints that we looked at. We also wanted to talk to a partner. Crossix had a really good partnership and had worked with them quite a bit. And so if you remember the headwinds that we talked about, I wanted to make sure that like everybody going in was aligned and aware of the objectives that we were trying to meet. Our brand was one of the clients that we work for. It's one of the top pharmaceutical companies in the world. So what we did to set up the test, we actually outlined a 6-cell test. What we did, I took the BDIs by DMA and outlined those according from high to low. That was just simply the share of the brand compared to the share of the category. We also overlaid that with the Crossix data to get down to zones. We couldn't get down to household level data in this particular situation because of privacy compliance laws. I can't get down to household level because of healthcare privacy. So we overlaid those two into high propensity to convert to the brand. That's from the Crossix data, and mid propensity. We'd actually kind of thought about whether or not we wanted to do a 9-cell test to do low propensity, but if they're not likely to convert to the brand, I didn't think we were going to have much ability to be able to convert them. So my expected winner here was actually the high propensity in the low DMA. If it's an underdeveloped market and they have a high propensity to convert to this drug, I was like, oh sure, this is going to be the winner. This is going to be easy. So I don't expect you to be able to read this, but it just kind of what it looked like when we went to the final. We broke down those DMAs into those zones of how likely they were to convert to the brand, and it worked out to be 248 different cable zones that we were going to be running the advertising in. We overlaid that on top of our traditional national television buy. You can see this is the networks that we buy. We buy these networks actually based on the Crossix data. So we get indices from each one of these networks based on their propensity to convert. So we buy on women 25 to 54, but we also convert that into likely to convert to our drug. So it gives us one more layer of data that we can use when we're buying these networks, because we even see some networks that do really well on women 25 to 54 and don't do well on our propensity to convert to the drug. So this is the way it ended up looking. I set up the test so that it would be a 50% heavy up. That's based on the old school rule of any time we do a television heavy up, you need at least a 50 to 100% heavy up to be able to read a significant difference. Where we ended up was a 62% heavy up on national. You can see that it's a little scattered here in the middle. The politicals really kind of crushed us. Sorry for you guys that are doing politicals, but that was really hard on us to be able to fulfill this. So that's something I need to think about as we move forward, especially into 2020, if we want to continue to do this kind of a program. We really struggled to be able to get that inventory, but we work with Crossix closely. They assured us as we go through that as long as we deliver the TRPs by the end, that we would be fine. So where we ended up on the conversion rate, if you look at these net conversions of those that were actually exposed, we could compare those to what we were able to do in national. And what I mean by conversion here is actually people that actually converted. Remember that we have that prescription data, people that actually converted to the drug. So for national, it was a 0.006. Then for addressable, 0.009. And this is pretty typical for the numbers that we see in the pharma space. The numbers are usually pretty small compared to like the immense delivery that I can get with TV versus those that actually do convert. So we were pretty excited about these results. Even more exciting to me was the ROI results. I measured on ROI on actually 2 different measures, and the addressable was significantly higher on ROI in both of them. Just to unpack some of those learnings, while it was very exciting to have the conversion results, also to kind of unpack some of the other learnings that we got. One that I thought was significant, we reached about 12 million households. So we had picked that charter to be able to have the biggest footprint. So this actually 12 million was just a little bit disappointing to me to see that number be as small as it was. So that's something to think about as we move forward. The other thing here, the profile of the households reached, about 24% of those that we reached were treating in category. So what that means to us, if we think about composition of the audience numbers, that's pretty exciting. When we look at national, this is Crossix data. I usually think of it just of an index. So what I'm usually able to deliver with a national plan for our index in terms of delivery of that likelihood to convert to our brand, it's about a 120. What we were able to deliver with the addressable on that treating and brand is about a 140. So significantly higher targeted of what we were able to do, even though we really only can go down to that household level because of privacy issues. Another thing that we need to think about when we move forward, we have 5 different segments that we look at for this brand. Working moms is actually our primary, so you can tell we significantly delivered the empty nesters, which is those 50 plus. So once again, that client that likes to give me a really hard time gave me a hard time even though I'm actually buying working moms. I'm over delivering empty nesters. So I had to set up quite a bit of information in terms of, I know everybody knows how television works, that we're over delivering on an older audience, but that's also something to think about as we move forward with our bigger platform and how we want to really beef up other opportunities to reach those working moms. The other thing that I thought was interesting, remember when I talked about what the projected winner would be those that had the high propensity to convert, but were also in those low BDI or underdeveloped DMAs. But what we actually saw, there was very little difference between the high propensity to convert and the middle propensity to convert in the Crossix data. So that didn't have as big of an impact as what I thought it would. Where we actually saw the difference in terms of the conversion rates is in those DMAs. So the high and medium BDI DMAs were the ones where we saw all the value. We didn't see as much value in the low BDI. So that's something for us to think about as we structure how we want to move forward with these types of activities in the future, and probably not even address those at all. So moving forward, some of the results takeaway, we did see that positive ROI. So we definitely want to make an expansion into Addressable in 2019. I mentioned a little bit as I went through here that it was a little limited in scale. We had about 12 million households, which when you compare to the 120 million universe, we have a lot of room to expand there. So we want to continue with Charter, but next year I want to also start to explore some different kinds of opportunities with some other vendors. We over-delivered the mature audience. So I want to start to think about other channels that we can start to explore where I can start to deliver those younger audiences like the young professionals and the working moms that we're also trying to reach. We also, like I mentioned, saw the highest response from those high and medium BDIs. So we want to think about that going forward for this particular kind of an opportunity. And also start to think about, we haven't done a lot of geography. So start to think about geography layering in all of our other opportunities as well. And that's all that I have. Did I make my 10 minutes?
You were perfect. Thank you so much, Sonya. Stay right there.